Honorable Ministers, Honorable Permanent Secretaries, distinguished keynote speakers, dear participants, I take this opportunity to appreciate and thank the Honorable Ministers, the Honorable Permanent Secretaries, the distinguished keynote speakers, and fellow participants for taking time out of your busy schedule to attend this important conference. This conference has been organized virtually because of COVID-19 pandemic that has caused loss of lives. We stand with the world to fight the pandemic through strengthening health and telemedicine applications and systems in the EAC region. Ladies and gentlemen, the heads of state for the 8th summit held in November 2006, together with approval of ES regional e-government framework by the 13th ordinary meeting of the EAC Council of Ministers, placed e-health as one of the 7 focus areas in the implementation of e-government programs. Ladies and gentlemen, the EAC countries share similar challenges related to effective delivery of health services, especially with this COVID pandemic. At the regional level, we still have poor access to health services and poor quality of health services, which result in high disease burden, which in turn grossly reduces the standard of living of our communities and stunts socioeconomic development. Ladies and gentlemen, with the limited resources available for a significant number of competing challenges, more effective deployment of ICT in the health sector offers a range of solutions and applications that can be used to greatly improve the efficiency and the quality of service delivery. Hence, e-health and telemedicine are very important elements of effective health systems. Ladies and gentlemen, it's against this background that we decided to devote our 3rd e-health and telemedicine workshop and conference to the theme, Embracing Digital Technologies to Foster Innovations in Health Care for the Well-being of East Africans. Ladies and gentlemen, this hybrid conference follows up on the implementation of the resolutions of the 2nd workshop held in May 2019. This meeting introduces EAC public and private sector decision makers solutions that will enable the improvement of healthcare infrastructure and delivery through the use of ICTs. Ladies and gentlemen, the 2nd e-health regional e-health and the telemedicine workshop conference considered the following matters. 1, policy and regulatory framework for e-health. 2, sustainable financing modules for e-health and telemedicine. 3, infrastructure and technologies for e-health and telemedicine. Ladies and gentlemen, the main objective of the workshop and ministerial conference is to provide a dialogue platform for academia, researchers, technologists, developers, and government decision makers to present and discuss existing and new digital technologies for enhancing healthcare in East Africa. Ladies and gentlemen, the agenda of this conference focuses on the issues related to resolutions of the 2nd e-health conference, which include the following. 1, the environment for healthcare, including implementation of e-health policies and strategies, governance mechanism and institutional infrastructure with partnership for digital health. The 2nd is human capacity and skills development for digital e-health. The 3rd is digital technology innovations for health, including approaches to telehealth, mobile and virtual health, standards, system integration, big data, Internet of Things, applications that will advance e-health among and between EAC partner states. Ladies and gentlemen, by the end of this workshop and the ministerial conference, we expect to achieve the following. 1, to evaluate the implementation of the resolution from the 2nd e-health regional e-health and telemedicine workshop and ministerial conference. 2, share experience, evidence, and lessons learned from the e-health interventions and actions agreed for scaling up the use of ICT for health. 3rd, evaluate the developed roadmap for the regional collaboration in capacity building to enhance digital skills for health personnel. 4, how the stakeholders' commitments were energized towards the achievement of the third Sustainable Development Goal targets for the EAC region through EAC and informatics. 5, adoption and adaptation and use of innovative and emerging digital solutions for health identified in the EAC partner states. 6, awareness raised on the application available and recommendations formulated on the contribution of partner states, EAC organs and institutions in support of regional digital health initiatives. Ladies and gentlemen, this third e-health workshop and ministerial conference is co-organized with East African Health Research Commission, EAC Secretariat, ESTECO, University of Rwanda, Center of Excellence for Bioengineering, and with financial support from the Broadreach, Vital Wave Inc., and UCDF Uganda. I thank you all and wish you a great deliberations in this conference. I now welcome our moderator, Ms. Gertrude Ngabirano, to take us through the rest of this session. I thank you all.
Excellent. My name is Gertrude Ngabirano, and I'll be your moderator for this session. Mr. Frederick Kamsime, Minister of Foreign Affairs and International Cooperation, East African Community, Republic of Rwanda. Honorable Dr. Monica Musenero, Minister of Science, Technology and Innovation, Republic of Uganda. Honorable Bazivamo Christophe, Deputy Secretary General, East African Community. Distinguished workshop participants in your various capacities, ladies and gentlemen, all protocol observed. A warm welcome to this first session of the third EAC Health and Telemedicine Conference and Trade Exhibition, which we are holding virtually. This is something that will be happening, I think, more frequently, and it is the way to go, and we are still managing to get business done. This first session that will set the tone for the whole of the conference. And as you've heard, the conference theme is embracing digital technologies to foster innovations in healthcare for the well-being of East Africans. Most welcome, Honorable Christophe Bazivamo, to give us your opening address. Over to you.
Let me again take this opportunity and say good morning, everyone. Honorable Ministers, you are present, Honorable Permanent Secretaries, distinguished keynote speakers, ladies and gentlemen. Regional integration efforts in the East African community have advanced rapidly in recent years as the EAC partner states move to harmonize their economies, transform their societies, and improve standards of living. National leaders have made regional digital transformation a key pillar of the East African community modernization agenda, as laid out in Vision 2050 and in the 6th East African Community Development Strategy. Recently, the East African Community Science and Technology Commission signed a memorandum of understanding on behalf of the East African community with Vital Wave Inc. to apply an enterprise architecture approach that enables and supports a comprehensive East African community regional digital agenda across a number of key sectors. This partnership will initially build on the progress made over the last several years in the health sector, which saw the development and the ratification of a 10-year roadmap and costed implementation plan for the digital regional East African Community Health Initiative. Ladies and gentlemen, momentum for digital health in the East African Community region has been growing steadily, and specifically the East African community has been engaged in leading several regional initiatives on digital health. In 2010, the East African community convened a regional e-health workshop and ministerial conference for members countries to share experience and insight on how to move e-health forward in the region. As a follow-on to the inaugural conference held in 2010, the East African Science and Technology Commission, ISTECO, in collaboration with the East African Secretariat and partner state, convened the second East African Community Regional e-Health and Telemedicine Ministerial Conference in Kigali, Rwanda, in May 2018. Ladies and gentlemen, the two-day conference attendees concurred that ISTECO, in collaboration with the East African Community Secretariat, the East African Community Health Research Commission, partner state National Science and Technology Commission, and sectoral councils and partners conduct an East African Community Regional e-health readiness assessment, incorporating aspects of systems interoperability, costs, and benefits of e-health investment by December 2019, meaning after 1 year. Second, promote the incubation of local digital health solutions and submit progress reports to the relevant sectoral and ministerial council every 2 years. Third, coordinate the development of regional policies, laws, regulations, guidelines, and standards on health facility and patient safety, data sharing, data security, and privacy to facilitate e-health in country, as well as cross-border patient referrals within East African Community Partner State by June 2020. Fourth, take leadership in convening the biannual EAC Regional e-Health and Telemedicine Ministerial Conference and associated workshops and international exhibition on a rotational basis among the partner states. Furthermore, in 2018, the EAC launched the Digital Regional East African Community Health Initiative, whose mission statement was to maximize the power of digital health in East Africa by ensuring enabling environment and by implementing scaled, coordinated transformational and innovative approaches through a shared roadmap for creating a regional enabling environment for digital health. The roadmap consisted of 9 work streams in which responsibilities were divided for the region and partner state. The work streams were organization, formation and management, health programs, infrastructure, services and applications, leadership and governance, strategy and investment, registration policy and compliance, workshop and harmonization, standards and interoperability. The premise behind the regional initiative was that regional ownership and development of some key components of the enabling environment for digital health will help partner states reduce costs by sharing those services that can be shared For example, hosting common technology components on a shared cloud, standardizing digital health training, and aggregating demand for certain services such as telemedicine. Ladies and gentlemen, the initiative was to develop the enabling environment, including policies, to facilitate cross-border data and information sharing. I'm delighted to inform you that EAC and East African Health Research Commission have delivered on this initiative targets, and we urge partner states to embrace digital technologies to foster innovations in healthcare in our region, East Africa. The East African community has unveiled a comprehensive COVID-19 response plan to reinforce measures to protect and prevent further spread of coronavirus pandemic within the region. This response plan was developed following a directive by a joint meeting of ministers responsible for health, trade, and ministers in charge of EAC affairs. Among the key interventions proposed in the plan are risk communication and community engagement, which entailed strengthening sensitization programs and awareness creation on COVID-19 in our East African community region. The response plan further seeks to ensure access to infection prevention and control materials, laboratory supplies, and equipment by West African community organs and institutions, and West African community partner state. I wish maybe to report that the plan has got funding and responses and measures are under implementation at regional level, but also in partner state. One of the example being the mobile labs which were deployed in all 6 partner states in our region. Another key intervention is to strengthen the region's capacity for COVID-19 surveillance and reporting at all key border points, and build knowledge on safety measures, existing prevention and control strategies, and relevant regional guidelines. Mitigation of the fundamental impacts of the pandemic on the vital economic and social sectors of the region, including micro, small, and medium enterprises, is another key intervention outlined in the plan. Other proposed measures include building regional capacity to support partner states on surveillance, monitoring, and coordination of preparedness and response to the pandemic, research and development, and resource mobilization. West African community is now working with partner states and development partners to keep on mobilizing resources and other stakeholders to achieve a broad coalition in stepping up preparedness against COVID and other pandemics in the region. These include airport authorities in partner states, points of entry, government regulatory agencies, and other regional organizations. And here I wish also to say that a couple of trainings for staff at airports and all ground borders, these trainings have been conducted, and the trainings of EAC mobile laboratory experts with experts in partner state has been done and completed, but it is still an ongoing process because the project around that is still on to build the capacity of actually a strong network of national lab to help in this area of the diagnostic. I wish to say that the East African community has also procured these 9 laboratories and finalize the distribution in the partner state. And this, as I said, have helped a lot. And we have trained a couple of people, especially training of trainers, and we are still working, and the project is still ongoing. And as I said, it is not only about COVID, but it covers other pandemics which can happen in the region. Ladies and gentlemen, the East African Community Regional eHealth Ministerial Conference will deliberate on the environment for eHealth policies, strategies, governance mechanisms, and institutional infrastructure, and partnerships for digital health. Second, human capacity and skills development for digital health. And third, digital technology innovation for health and interoperability that will advance eHealth among and between West African Community partner states. For ministerial conference, which is planned, we will urge East African Community partner states that do not have a national eHealth strategy, develop it in line with World Health Organization, ITU, National eHealth Strategy Toolkit. B, ISTECO to promote incubation of local digital health solutions in collaboration with the East African Community Secretariat and the partner state ministries and agencies responsible for ICT, science, and technology and innovation. And third, ISTECO in collaboration with East African Community Health Research Commission to develop the EAC regional digital health agenda framework. Fourth, being the last one, ISTECO in collaboration with the East African Health Research Commission to develop and implement the EAC regional digital health program that will embrace digital technologies to foster innovations in health for the well-being of East African community citizens. Honorable ministers, ladies and gentlemen, to conclude, let me take this opportunity to welcome you in this important conference and appreciate actually the commitment you have put in this process and also for work you are doing in this sector. And we wish actually to keep on together because together we are strong and ensure that we ensure transformation in our East African community. I thank you and wish you a successful conference and promise that ISTECO will implement the ministerial resolutions that will come out of this conference. Thank you very much.
Our next speaker is Honorable Dr. Monica Musenero, who is the Minister of Science, Technology and Innovation, Republic of Uganda. Honorable Minister, we are happy to have you. Most welcome to give your remarks.
It's worth noting that the Ministry of Health in Uganda developed the National eHealth Policy, which will probably be highlighted further by Dr. Diana. And subsequently, we have the National eHealth Policy of 2016 to guide the use of ICT in supporting health sector transformation. And as I said earlier, my ministry will work closely with the Ministry of Health and other government sectors to build and seek further to enhance innovations, particularly of the youth in ICT, towards contributing more diverse innovations in analyzing these policies. Uganda carried out an assessment to investigate the ICT services and infrastructure in the country, how data in the health system are collected and managed, referral ambiguities that result in loss of patients, follow-up, best practices for monitoring and evaluation, and the information pathway for a network of service providers who could be better supported through ICT. As I settle down on my duties as the Minister in charge of Science, Technology, and Innovation in Uganda, I would like to pledge my support and continued close working relationship with the East Africa Science and Technology Commission and the East African community as a whole to embrace digital technologies to foster innovation in healthcare for the well-being of East African. I thank you all for God and my country.
Excellent. So now we move on to our next speaker, who is Mr. Frederick Kamusime, from the Ministry of Foreign Affairs and International Cooperation and East African Community, Republic of Rwanda. Welcome, Mr. Kamusime.
Thank you so much, moderator, and good morning to Honorable Minister, and good morning to permanent secretaries, and good morning to Honorable DSG Bazivamo Christophe, and the Executive Secretary for ESTICO, Mr. Fortunate Muyambi. And good morning to also development partners. I believe this gathering is an effort from different people, from different partnerships. And we, from the start, we want to commend that partnership. Moderator and Honorable Minister and Permanent Secretaries, I'm delivering these remarks on behalf of my Permanent Secretary, Ms. Clementine Mucheka, who could not be able to attend this meeting because of another meeting that she's attending at this moment. Moderator and Honorable Minister, I want to first associate ourselves with the remarks from the different speakers on the role of ICT in terms of economic development and social development as well. From an economic perspective, probably ICT has been an industrial instrument. It has assisted in terms of production of goods. It has assisted in terms of leapfrogging, in terms of technology communication, but it has been not a strong element in terms of health. And now that we are going into the 21st century, this is the first, it should be a priority for East African countries to catch up and leverage this technology for purposes of health. But Honorable Minister and Permanent Secretaries, probably we need to shift the discussions from looking from only a health perspective, but also from an economic perspective for the African countries, and for East Africa in particular. If we had telemedicine, if we had e-medicine that is really working and e-health that is really working, then we stand a chance of reducing on capital freight, money that is usually spent by people who go out to seek medical services. And this does not cut out the fact that people will continue to enjoy and look for health services abroad, but they can cut out on hotel costs. They can cut out on travel costs. They stay in country, they seek the medicine wherever the best doctors are in the world, but they don't have to travel to those countries. They don't have to incur visa costs. They don't have to incur accommodation costs. And we believe that would be economic returns for the households. That money will be invested in educating people, educating family members, and that will create a big economic impact for our people and for the East Africans. As any other economic development moderator and honorable minister and permanent secretaries, there's always a downside. And the downside of e-health is that you're speaking to someone you don't know, and the platform could be misused. Someone would claim that you're a doctor, you're providing services, but in actual sense, someone in Mexico, there's no way you can certify that the person is actually a medical doctor. So we could look at the economic sides and having the e-health, telemedicine work in a way that we don't compromise on the quality, and we don't compromise on the integrity of the health sector that has been outstanding for many years, but also the risk that you're dealing with someone who doesn't actually have that practice, but just pretending to be in that field and have experience. Moderator, Honourable Minister, as I conclude, I want to commend the East African Science and Technology Commission for the big step it has taken to lead the way in terms of economic, in terms of e-health, in terms of having a discussion, initiating regional conversations on what should be done. This is the third conference, but being the third doesn't mean we are lagging behind. It means that what ESTICO is doing at the moment, it's a right step. It's proper timing, most especially that now we are transitioning from COVID. We have seen the challenges that COVID is having. We have seen a challenge that countries are facing. Now having a regional conversation on e-health makes the East African, the ESTICO, a real-time and practical institution for the community. That we are thinking what is actually happening in the countries, and we are thinking of what is affecting the households, what's affecting the daily person. Someone in the rural part of Rwanda, probably in Gisenyi, who doesn't know even how to get to India. It's very important that ESTICO now we're thinking of how mechanisms, bringing regional conversations on how that person can access medical facilities, medical services without necessarily traveling and without necessarily moving miles away. But also we want to look from an education perspective. What would happen if our nurses who are down in the village, somewhere down in Nyagatare, could access health education, medical trainings online from well-renowned universities, well-renowned institutions. It could be in the US, it could be also in another partner states, probably in Kenya, in Uganda. And the nurse would still remain in service, do the work deep in the village in Nyagatare that now we have internet, but continue to follow a training online. The nurse stays on, is serving people, stays on saving lives, but also having skills empowerment and capabilities. So we see e-health in a broader perspective. We see e-health in a way that it will facilitate a new economic venture, a new economic platform that we have never thought about. And we see it in a way that it's going to assist countries that the advantages we have seen in other sectors, in banking, that now we can send money to families, to business persons in any other partner state through the one area network within a minute. If we brought that experience to the health sector, that you can speak to a doctor in another country and get services in another country, that would be a big advantage and it would be a benefit to everyone. Chairperson and Honorable Minister and Permanent Secretaries, as I conclude, I want to say thank Uganda for the flexibility to host the third conference in a hybrid format. This is the third conference. The idea was to have a physical meeting and then host it in Uganda, but we had to move in quickly and the secretariat and make adjustment with the Uganda on hosting it a hybrid format. That shows the importance of technology, the importance of ICT, but also thank the ESTICO for making swift arrangements, because once the lockdown happened, they had to make quick shifts. So we thank ESTICO leadership for being proactive and for thinking out of the box. Instead of shifting the meeting, instead of postponing the meeting, you had to look for possibilities to have the meeting continue. I want to thank Honorable Minister, Permanent Secretaries, DSG Bazivamo, for making time and also joining us for this meeting. As a host of ESTICO, we're always looking for success, and we are proud of ESTICO for the work they're doing in this field. Thank you so much, Honorable Moderator and Honorables online. Thank you.
Excellent. Applause again. Thank you so much, Mr. Frederick Kamsibe, for those words. Indeed, we need to see e-health in a wider perspective, not only from a health perspective, but also from economic and education and other perspectives. Excellent. So that is something that we shall be discussing also in the conference. Ladies and gentlemen, honorable ministers, I think our guest of honor is in the house, and that is none other than Dr. Diana Atwine, who is the Permanent Secretary in the Ministry of Health of the Republic of Uganda. She's charged with technical leadership as well as stewardship of all financial resources at the ministry. And she's currently focusing on introducing reforms in culture, ethics, and values in the sector, which she believes will increase quality and access to healthcare. She is a staunch crusader against corruption in the health sector. Ladies and gentlemen, please welcome with me Dr. Diana Atwine to give us the keynote address.
I'm glad I'm here. Thank you so much for organizing this meeting. Honorable Ministers, Permanent Secretary present, distinguished keynote speakers, ladies and gentlemen, I want to thank you so much, especially East Africa, for inviting me to participate in this important e-health telemedicine ministerial conference that is timely to COVID pandemic being faced in the world. E-health cannot be overemphasized at this time, because I think this theme was so timely, because we have now, we can't appreciate this e-health now than what we have seen in this time of COVID, where everything has shifted to everything is e-governance, e-commerce, e-health. So we want to say that this is the way to go. It is the way to go, because right now you can see now the meeting is in Rwanda. We are discussing, and everything is going smoothly, and therefore this is now high time that we all embrace e-health in its totality. Ladies and gentlemen, the application of e-health have been classified as e-health in the provision of health services at a distance, the management of clinical and administrative information, that is health informatics, and sharing information and knowledge with healthcare providers, patients, and communities. Some of the key pressures facing the health sector include fragmentation of health-related information and insufficient interoperability and weak health information management. To be able to mitigate the above challenges, there is need to continuously improve the performance and capacity of the supply side to meet some of the growth in demand on healthcare services. The implementation of e-health is looked at as one of those solutions to mitigate the above challenges faced in the health sector, especially in Uganda. And I do believe that this cuts across all sister states. the Ministry of Health has implemented e-health services. First of all, we came up with e-health policy and e-health strategy that highlights key pillars that really guide the implementation of e-health in the country. And it has helped us to come up with a roadmap to implement this, but basing on principles that we put in the policy, because we noted that we had so many solutions. For example, in our country, we had, I think we had piloted over 50 solutions, and every time would come to the end, it would be like we are starting afresh. Every solution would be tested and get to the end, and then it stops there. We are saying any solution, first of all, we want to own solutions. We want to own solutions because what we are seeing would get support from partners. They come up with a solution, they pilot it, it is very nice. But when the program ends, it ends there. So we said, first of all, the solutions must be owned by the country. It must be taking into consideration the local content. The local content is that we must have our technical people, our IT brains in the country to participate in the development. So it must be homemade. Number three, it must be it must be scalable, or it must be what we call interoperability. It must be speaking to other systems in the country, and that way we can see the scalability of these solutions. At this time of COVID, when we have really a challenge of social distancing, keeping away from people, yet work must go on, it is high time that we embrace fully e-health solutions and we implement it in our health sector. This will, first of all, help us to have exchange of information. While, as Frederick said, we can get information, standard information, like you'd travel to any developed countries just using the telemedicine. In our country now, we are starting e-classes, and we have seen that that even we are able to exchange with the medical teams in other countries. We discuss some of these cases as if we are actually in the same class or in the same ward. So this is very helpful to, first of all, to have exchange of information. It is helpful even now in COVID that people don't have to congregate together, but yet the activities can go on and we can exchange information as we are doing now. It can also help us to get the best knowledge and training online, and then we can only have the practicability on as a second phase. But theory can be done. Actually, we have seen it. We have seen it in our fellowship program we are having with our students in the universities, with other students abroad. They have this exchange program. So it has really helped us to keep in touch, to remain relevant with other countries, to get the best information, updated information, and making sure that we reach out everyone at any one time, regardless of where they are. The challenge now as East Africa is to scale up the internet backbone so that it can get everywhere in all our countries. It is also important that we fund, and our governments need to see that we fund the activities that enhance e-health scale up. And for example, electronic medical records, so that we get away from paper, because this, first of all, becomes very easy in data management. It becomes easy in planning. It becomes easy in monitoring and evaluation once you have the right data and in real time. It helps us to, we as leaders in these sectors, it helps us to make quick decisions. And therefore, really, I cannot overemphasize the role of e-health, the role of e-governance, the role of ICT solutions to help us do better, connect to the world. Now it is a global village, and to keep abreast of what is happening. Ladies and gentlemen, Ministry of Health is committed to supporting this endeavor, and we are already on the road to implementation. And specifically, I want really to thank East African community. I want to thank the organizers of this meeting to bring us together. We look forward to receiving the recommendations that East African community will come up with, so that it helps us to speak as one voice, even when we're negotiating with our partners, when we are negotiating with the funders of these solutions. We need to speak as one so that we have a bigger voice. Thank you so much. I wish you good deliberations. And I want to also say that because of now establishment of East Africa, the Ministry of Science and Technology and Innovation is going to help us to move faster, because now this bucket is specifically dedicated to supporting all the innovations in technology, in science, and that will really help us to run. Thank you so much, and have a blessed day.
So, ladies and gentlemen, we've come to the end of our opening remarks. I take this opportunity to thank our speakers. I thank you for prioritizing this meeting and for taking the time to address us. So, Honorable Christophe Bazivamo, Honorable Dr. Monica Musenero, Minister for Science, Technology and Innovation in Uganda, Mr. Frederick Kamusime from the Ministry of Foreign Affairs and East African Community, Republic of Rwanda, and Dr. Diana Twine, Permanent Secretary, Ministry of Health, Uganda. Thank you so much. We look forward as East African citizens to our countries implementing the digital solutions that will be agreed. So we thank you so much. We are sorry that you cannot hear the applause, but we are grateful. You have given us a few things to think about. The last one from Dr. Twine was that we need to own our solutions, the solutions that we come up with, that we adopt, taking into consideration the local conditions. So thank you so much.